everyone, welcome back to my channel. My name is Diana. I'm an overseas nurse who is currently practicing in the UK. Hope you are all doing well. In this video, I'm going to talk to you about some of the terms you're likely to hear when you start working on the ward, either as a newly qualified nurse or as an overseas nurse who is currently practicing here in the UK. I know how confusing it can be sometimes, especially on your first day in the ward, when you hear some of the nurses mention some terminologies, or when you hear some of the nurses mention some terminologies, or even the doctors asking you all sorts of questions using certain words, using certain terminologies that you wonder sometimes if they are even mentioning English words at all. So this is just a simple video to break down some of the terms that you're likely to hear, or you're likely even to see in the patient's notes when you start work, so that it will not be confusing for you, because I really did struggle a little bit when I started and I kept asking questions over and over again. So this is just an explanation of some of the basic terms that you're likely to hear, so that it will make your life easier for you when you start working on the ward. So the first term I would like to talk about is TTO. So normally when you hear TTO, what it basically means is tablets to take home. So a colleague or maybe the nurse in charge of the shift might ask you, your patient is going home and he needs TTO, or might ask you, are the TTOs ready? As a newly qualified nurse, you might be wondering what TTO is, or what it means, or what you're supposed to do at all. So basically what it means is tablet that the patient is supposed to take home with. So normally, sometimes when patients come on admission, they come with all sorts of medications, and sometimes they do review their medications and take some out. Sometimes a patient might develop infection whilst on admission, and they might prescribe like a whole course of antibiotics. Some they are able to finish whilst on admission, some they will need to take them home. So basically when we talk about TTO, it's just a list of all the medication that the patient is supposed to go home with. So if the patient is supposed to go home today, what the doctors will normally do is they will just review all the medications the patients are on currently. Any medication that needs to be added, they will do that. And then what will be done next is the pharmacist would have to review or screen it. Once it's screened, if there's any tablets that has been prescribed, a newly prescribed tablet, they'll make sure they order it from the pharmacy. And then it comes to what you, the nurse, would have to do. Normally, if a patient is going home, there is this sheet they call a discharge summary. So a discharge summary is basically what happened right from the time the patient was admitted until the point where he's going home, and also a recommendation of what the GP also needs to do. Behind this discharge summary, there is always a TTO checklist. So that's a sheet of paper that has a list of all the medications that the patient is supposed to go home with. So what you'd have to do in this situation as a nurse is just to take all the medication the patient has already, add any newly prescribed medication, take this sheet of paper, that's the TTO checklist, and make sure that every tablet listed on that TTO checklist is in the cupboard ready to go. So you just take them as and when you take them out. And you can do this with a colleague just to be sure that everything is intact. And also make sure that the name of the patient is on the tablet, because sometimes they might be mixed up. It might have a different patient's name. So just so that you don't end up giving a wrong medication to a wrong patient. So once you've checked all of this, if there's any medication or any tablet that was left behind and not in the TTO checklist, it means the patient is not supposed to go home with that. Either it's been discontinued, the patient doesn't need it anymore. So what do you do then with the rest of the medication that are not needed? Each hospital have their own protocol as to what to do with tablets that are not needed. So in my hospital, for instance, they had in the treatment room, there was this box that had boldly written on it, return to pharmacy. So you just have to put all those medications that are not needed in that box, and the pharmacist will normally come around to take them to the pharmacy. So basically when you hear TTO, or when you hear a doctor asking, is the TTO ready for this patient, is supposed to go home, basically it's just a list of all the tablets that this patient is supposed to go home with at that moment. The terminology I'd like to talk about is OJD, and that means esophago-gastro-duodenoscopy. It's quite a long word, but you can simply say endoscopy or gastroscopy. It means the same thing. So basically, it's just a procedure or a test that is used to identify or diagnose problems like cancer, stomach ulcers, and it's just an examination of the inner lining of the gastrointestinal tract. That is the esophagus, the stomach, upper parts of the small intestines. And when the patient is currently complaining of difficulty in swallowing or having bleeding through the mouth or bleeding through the stools, the doctors might request for such tests just to be able to diagnose or confirm. So when you hear OGD, this is what it basically means. And like I said, I've worked in the gastro ward before, so I used to hear this term often, and that is why I say you are likely to hear it more if you work in the gastrointestinal ward, but you might hear it in any other ward as well. So if you are nursing a patient in maybe an orthopedic ward and this patient starts experiencing some of these symptoms like difficulty in swallowing which is persistent, they might request for such OGD just to be able to identify or diagnose any of such gastrointestinal problems. So the next terminology I'm going to talk to you about is NAD. So normally when you hear NAD, you ask yourself, what does NAD means? Or when you take up from a nurse and she tells you this patient went in for this procedure and the result was NAD. So you might think the NAD is actually a diagnosis. So what this NAD means, no abnormality detected. So that means this patient has gone in for a procedure. So for instance, if a patient went in for like OGD, which I previously mentioned, and it says the result is NAD, that means there was no abnormality detected. Everything is fine. So when you see NAD, don't think it's like a diagnosis or anything. It's just the results of whatever procedure the patient went in for. So NAD means no abnormality detected. Another word you are likely to hear irrespective of whatever ward you are working in is DNAR or NFR or DNR. So they mean the same thing. DNAR means do not attempt resuscitation, and NFR means not for resource or not for resuscitation, and DNR means do not resuscitate. So basically it means that this patient does not want to be resuscitated in case they suffer a cardiac arrest. So that DNAR is a legal form which the doctors would have to complete based on the assessment of the fact that this patient has a lot of comorbidities, and even if he suffers a cardiac arrest and is resuscitated, the quality of life may be so poor that it might not even be necessary to resuscitate this patient. So normally the doctors do not take this decision on their own. They have to discuss it with the patients, and also the relatives will definitely have to come in at some point. And once it's agreed that, oh, this patient is old, number one, he's got so many comorbidities. If this patient suffers a cardiac arrest and is resuscitated, the quality of life will be so poor. He'll keep coming back to the hospital, he'll keep taking injections, he'll keep taking tablets. Then they will decide to discuss this with the patients and just make a decision in the patient's best interest to rather not to be resuscitated when he suffers a cardiac arrest than resuscitating the patient and he's suffering over and over again. So basically, when you see in the patient notes that DNAR, this is what it means. The patient does not want to be resuscitated in case he suffers a cardiac arrest. So normally when a patient is going home, this patient is a legal document, it's signed by the doctor and has to go with the patient wherever he's going to. So in case the patient is even transferred from your ward to another ward, it has to go with him or her. If he's going to another hospital, it has to go. And even if the patient is going home, it has to go with all the paperwork that is going home with. And normally, if the transport services come to pick up the patient, you have to mention it to them that this patient is not for resource, or this patient has DNAR, and you have to hand over that sheet to the transport service just in case anything happens along the road. They know that this patient does not want to be resuscitated. So that is what DNAR means. If you hear DNAR, it means do not attempt resuscitation for this patient in case they suffer a cardiac arrest. So the next term I'd like to mention is PTOT. So when you hear PTOT, what it means is physiotherapy or occupational therapy. So normally you see this in the handover or even in the patient notes. you see PTOT and you see their notes. So what it means is physiotherapy or occupational therapy. Or you can even see in the handover that this patient needs a physiotherapy assessment or patient needs PTOT assessment. So that's what it means. Sometimes when the patients come in, the patient might even come in with a fall, and obviously they'll be so weak to walk, or they are off completely from their baseline. So, you know, healthcare is not just about you giving medications. It's holistic. So it's not about attending to the patient's medical needs. So what the physios also do is to come in each and every morning to assess all of these patients, see how strong they are, what they can do for them, or what the patients can do for themselves, how they are able to transfer, how they are able to walk. They do range of motion exercises with them. And when they realize that this patient is not able to walk on their own, they can sometimes request for walking aids, like walking sticks, frames, and everything. So when you hear PTOT, basically what it means is this patient is off their baseline mobility-wise, and therefore they need the assessment of physiotherapist or occupational therapist. Terminology I'm going to talk to you about is definitely linked to the PTOT assessment, and that is ZFAO1, or sometimes you can hear ZFAO2. So what the ZFAO1 means, Sigma frame with assistance of 1. And what the ZFAO2 means, Sigma frame with assistance of 2. So like I said, when the PTOT or when the physiotherapists have come to do the assessment of the patient and realize, oh, this patient is too weak to walk on its own, what they might recommend is for the patient to walk with the Sigma frame. So when you see that ZF, it means Sigma frame. So you're likely to see it in the PTOT assessment section of the handover. So if it's ZF with assistance of 1, it means this patient needs to walk with Sigma frame, but with assistance of 1 person. And when you see ZFAO2, means this patient needs to walk with a Sigma frame with assistance of 2 people. So that's basically what it means. So we've come to the end of this video. I hope you enjoyed it, and if you want me to do a part 2, I'm definitely happy to do that. So if there's any terminology you use in your ward or in your hospital that you'd like to mention, you are free to do that in the comment section. Definitely people from other hospitals or other wards may learn from it as well. Hope you enjoyed it, and see you in my next video.